Hey everyone, today we are going to discuss regarding sideroblastic anemia. What is sideroblastic anemia? What are the common causes? What are the clinical manifestations? What are the lab diagnostic features? And how to manage the sideroblastic anemia. So this is all the outlines of the presentation what we are going to have. So please stay tuned till the end of the video and jot down all the important points. So sideroblastic anemia, as the name implies, there is presence of sideroblast is required. So what is sideroblast? Sideroblasts are normoblasts are the developing erythroblast containing excess of iron granules in the ring form, and that we call it as sideroblast, or popularly known as ring sideroblast. Now this excess iron accumulation, how does it happen in the erythroblast? It could be acquired causes or congenital causes. Coming to congenital causes first, there is a delta ALA synthetase defect that can lead to defective heme synthesis. So defective heme synthesis, there will be iron overload because iron is not getting utilized for the heme formation. So because the iron is already available, so iron is distributed, excess iron is distributed in the form of granules in the developing normoblast. So that's how the ring sideroblast emerges. The acquired causes could be lead poisoning is a common cause, chronic alcoholism is a very common cause, and apart from that myelodysplastic syndrome, copper deficiency could be a cause, and apart from that various drugs, isoniazid, chloramphenicol, all these can cause this kind of a defect as well, particularly isoniazid, so which causes vitamin B6 pyridoxine defect, which is an independent cause of sideroblastic anemia itself. So what are the lab findings? How will you diagnose sideroblastic anemia? Sideroblastic anemia, if it is a lead poisoning case, you will see excess of lead in the blood as well as in the urine. And apart from that, the generalized causes of generalized lab investigation of this sideroblastic anemia will reveal deranged iron profile completely. So all the iron indices will be high, like serum iron, serum ferritin, and transferrin saturation. TIBC, which is like inversely proportional to that of the ferritin concentration. So it will generally be in the lower side, normal to low TIBC will be seen over here. And apart from that, there will be basophilic stippling of the RBCs in the peripheral smear. That will be a notable feature. So due to denaturation of various enzymes in the heme synthesis, particularly in the lead poisoning, it is very common, basophilic stippling. And apart from that, you will also see blue to purple granules, that is some form of excess iron granules may even be seen in the peripheral smear, which is called as Pappenheimer bodies, and these RBCs are sometimes called as siderocytes. So these are the key features that you will observe, diagnostic features in sideroblastic anemia. Excessive cases, there may be even hemosiderosis, excess iron deposition may be seen in the liver and other organs as well. And how to manage the patient? Management of the underlying cause has to be done, and with the lead specific antidotes have to be given, and a specific treatment of the underlying cause is mandatory, and pyridoxine can be supplemented. B6, that is one of the specific cause for specific treatment for sideroblastic anemia. So now let's come to the summary, have a quick recap of sideroblastic anemia, what we learned. Sideroblastic anemia is due to excessive iron overload due to defective heme synthesis. Congenital cause, defective ALA delta synthetase. Acquired causes, myelodysplastic syndrome, copper deficiency, chronic alcoholism, lead poisoning. These are the common causes, and all iron profile will be deranged, that is serum iron, TIBC, serum iron, serum ferritin, and transferrin saturation will be raised, and TIBC will be on the lower side. And peripheral smear, you are going to see basophilic smears, basophilic stippling, and you are also going to see some Pappenheimer bodies. And treatment of underlying cause and pyridoxine supplementation have to be done. Thank you. Thank you for watching the video. Please subscribe to the channel, hit the bell icon, and follow in our different groups. And please stay tuned for the next video. See you in the next video. Thank you.